Okay, well, here we are again with another apparently so episode, if you will. We're going to talk today to Dakota Davis. He is with Nashville Midtown Surgical. Now, those are a lot of scary words, surgical, right? So we got to talk through that a little bit. But at the end of the day, Dakota is going to help us with dental stuff, right? So families, if you're watching this, or parents or guardians or conservators of your so this is going to be for pretty much all ages. Okay, and I'm going to let Dakota talk through that. But if you're just clicking on this for the first time and watching it, this is going to cover all ages. And this is going to be a scenario where you're not going to replace your dentist. You're going to introduce your dentist to Dakota and Nashville Midtown, right? Because they're going to help with sedation and dealing with the scary stuff. Okay, so that's kind of the general idea of today, and we'll get going. We'll just dive right in. So I've got the website up for Nashville Midtown Surgical. This is kind of a just a glimpse of who they are, and I may click around a little bit, but I'm going to stop talking now and let Dakota go and kind of explain what they do, and then I may click around, or he may tell me to click on something if I have to. Okay, so Dakota, tell us a little bit about just the history, what you guys do, and then help us navigate what should parents do, and how do they get connected? How do they line up their dentist with you, and what's the process look like, and all that good stuff.
Yeah, absolutely. And this might help too, Scott. If you want to click on those locations,
There we go.
and then let me see. If you scroll down, should have a place where you can pick all of the. Yeah, there it is. So let's pick Tennessee, and then yep, the only one in Tennessee. If you want to click that little box below it, the Nashville Midtown Surgical. Oh yeah, that's our page. So this page tells everyone a little bit more about our center directly. It'll tell you obviously what services we provide, contact information, brief insurances. Those aren't going to be all of the insurances that we accept. However, those are the ones that we see the most. So they just list them on the website so that families and caretakers know. And then actually below that are our dentists. So the providers, and this is for one, families to see, but two, if they want to get more info, they can go on this page. They can click on our providers. They can actually click into the doctor, his name, and it'll give you a little bit more information. Where he came from, what college he did his residency at, what affiliations he has, what training he has, etc. So, kind of just gives you a little bit more synopsis, a little bit more insight on our doctors. But basically, we are it's Blue Cloud Pediatric Surgery Centers, but not to confuse everyone in the Tennessee area, it'll be Nashville Midtown Surgical. They just name it based off the location that you're in. But kind of what we're known for, we have some centers around the U.S. We're starting to open up more. They look to open about 6 to 8 a year in different states and new states. So this one in Nashville opened up in December of 2024, and started taking patients, or I should say, started letting offices know what we do in April of last year. So I basically am the referral partner for this office. So I just go in, I visit dentist offices, I let them know what it is that we do, how we can help them, and how they can refer patients. So it's deep sedation dentistry. Basically, it's general anesthesia or IV sedation, which I'm sure a lot of these parents are familiar with if they have someone that is needing dental work done under sedation. And we do anything from general and restorative work, which is, like crowns, fillings, caps, that nature of dental work. We will do cleanings, regular dental cleanings, regular exams for families that can't find a main dental home to get this work done for their kid or caretaker. Um, we've got we've got doctors that will do the endodontic, which is like a root canal. They'll do any tooth and any age. And our age ranges are 2 to 18 for pediatric, so pediatric kiddos, 2 all the way to 70 for special needs. So we can see basically Basically, 2 is our limit when, teeth start popping in that you can take care of. So we just put it at 2 all the way to 70 years old. And we are able to do basically the deep sedation dentistry that the office or doctor is not comfortable doing in office. We are able to do all of the work that needs to be done in one setting. Put the patient under, wake them back up, and then send them back to their main dental home with all the work completed. So that's kind of a little bit more about what we do. And like I said, if you have any specific questions, we more than happily can get into those.
Fantastic. Now, I'm opening up some of these frequently asked questions on the website because this is really great because this is what, a lot of families would ask, right? And
Yep.
so that's obviously why it's called the frequently asked questions. But it helps that your 10 care, especially when it comes to, or Medicaid, right? A lot of
Yep.
people don't even realize that, just for folks listening, we hear the word 10 care, we forget that that's still Medicaid, right? So a lot of people don't even know that. And so that's it's worth mentioning that when you see that they accept Medicaid, that's the same thing. It's just called 10 care in the
Yep.
state of Tennessee, right?
Yep.
But ultimately that's big because a lot of times, especially the over 19, when they get into that adult child scenario, they end up on Medicaid when they're adults, and then go from there. And sometimes, this is where it might throw a curveball for some parents, but sometimes they end up on Medicare and Medicaid, right? They've got
Yep.
both. And there's the additional dental benefit that comes with that Medicare if they decide to add the dual special needs program, the Advantage plan on top of that, right? So
Yeah.
there's some extra things there that we can, and that's, the parents can ask, from there, about getting details on that. But at the end of the day, children, they can bring their siblings to the appointment, right? Now nobody's going in the room though, right? When the dentist is doing the procedure and there's an anesthesia and stuff, like no one's there, right?
Correct. So when they're back in the room, we are what you call, and again, big fancy words, but not to scare anyone. We're an ambulatory surgery center, so it's an ASC. So basically, it's a step down from a hospital, but not a hospital. We're able to do a lot more in office, safely, sedation wise, that you would do as opposed to in a dentist office. It's just a lot more safer to do it in a surgery center rather a regular dentist office. And then with us being a step below the hospital, there's just not as many, let me say, like medical complications that we're able to see as a hospital would, but we're still able to see more than the dentist office can. So basically that is where, that's where we find that little groove to help people out. No one goes back in the room with the patient when they're in what is said our OR. However, we have post-op bays. It's got a glass sliding door that they roll the patient or the child into after surgery. The parent can come back. The parent's normally waiting in that little room for them. They bring them back. The parents there the whole time. They wake up from anesthesia. They're getting the post-op treatment directly from the hygienist, telling them this is what you can and can't do. And then they wheel them out. We've got a little bay out back. They wheel them out to the car, load them up, and send them on their way.
Fantastic. So, some of the things that happen with parents, we our kids graduate from being pediatric to being adult, and sometimes we move, and sometimes there's people that are new to the state or they're new to a diagnosis and whatever, and they never really thought about having this type of an issue where they would need sedation, to be treated. So, I guess walk us through, Dakota. What can they call you direct? Do they have to have a dentist that's already working with them? What if their dentist, left town? We have a couple times where some facilities have closed and whatever. Or what happens if they don't currently have a dentist because they've just been worried that, well, nobody will see my child and whatever.
Yep.
What would you tell those parents?
So in that scenario, for example, Kramer Davis, I'm sure we both know about Kramer Davis, but Kramer Davis
Good
shut
example,
down.
yeah.
And they sent us one. Luckily, I knew the doctor there, so she had sent us a lot of patients before they officially closed, and she knew about us. So she was handing out our phone number. There's going to be a few ways that you guys can get referred over to us. So one, it could either be your dentist telling you, about us and offering up that phone number for you to call and get scheduled, or two, you telling your dentist, hey, this is where I would like to try out and go. But actually, if you, that top right button, Scott, that refer a patient, if you
Yep,
wanted
right up here, the dark blue button.
yes, sir, if you want to click that and then click Tennessee, the state of Tennessee, and then that little drop down box, the Nashville Midtown, whenever it loads. So
There you go.
this could be a self referral for the parents. So if they don't
Okay.
have a dental home, they don't have anywhere to go. No one's really helping them out as telling them this is where you can and can't go. They can pull up our website directly, refer a patient, click the state of Tennessee, click that little box, drop down in this referral form, and then they just need to fill out what is red asterisk. Once they do that, we have a call center that reaches out within 24 hours and they call the parent. They go over medical history, medical questions, screening questions, and then they find the best day and time that works good for the parent and then gives them obviously our location and goes over any questions that the parent has. So that's one way. Or they can reach out to me directly if they don't want to deal with online, they don't want to deal with the website, they don't want to deal with computer. They can reach out to me directly, my phone number, and I can get them scheduled.
Fantastic. I'll give you a chance. I guess, first of all, is your phone number listed on the website anywhere, or do you want to share
Yes.
that with the folks?
Yes,
Or
sir. Yeah. So I'm one. I can share it with everyone. My phone number, it's Dakota Davis, but my phone number is 270-499-8672. And yeah, if you click on that state of Tennessee again and scroll to the very bottom at
I see your
referral function.
emails right there.
Yeah. So that's right. Oh yeah, that is my only email. So if
Okay.
they click on that, so either or, they can do
Okay.
that, or I can send out my phone number as well, whatever's going to be easiest. But yeah, my
Yeah.
phone number is 270-499-8672. So I can help them. Or matter of fact, too, that little 615 phone number, that's actually the call center phone number. So they could call that directly too.
Okay, great. So there is an option if they don't currently have a dentist or whatever that they can go direct right now. Now,
Absolutely.
there's parents out there that are going to say, well, you don't know my kid. He's really really hard, or she's really
Yep.
really hard, or whatever. What would you say to those parents?
And our staff, they love what they do. This is all they do all day long. A lot of them came from either the pediatric background or they were working directly with the dentist who only saw special needs patients. So this is quite literally like our facility administrator right there, Melissa Goodman. This
Yep.
is all she does all day long. She helps out with staffing. She helps out with scheduling. She walks the patients to and from the post-op rooms, goes around the halls with them. They really make these patients feel, one, safe, comfortable, but two, no one is judged. I've never seen any judgment. They truly love what they're doing, and I would like to say, and I've said it on the Facebook group too, but they take the utmost care in what they're doing. They care about what they're doing because they know that this is a tight knit community, right? Everyone knows everybody. Everyone knows each other's resources for the most part, but that's why we're trying to enlighten them, just trying to help. But that's where that's where we see ourselves, is just help, right? There's no one, I mean, and I'm sure you as well as you know, but as soon as they get out of that pediatric age range, it's like we're just fighting, it's like we're fighting against the wolves. There's no one to go, no one to help. Insurance companies don't help all too much when you're given a list of dental companies that take your insurance. Are they still there? Are they still open? So these staff members, they truly care about what they're doing. So I mean, if it's someone that's got a concern about their kid, about who they're bringing, I would like to say, and I put my hand on this, but they're not going to find better care at the surgery center, along with the staff members that know what they're doing and care about what they're doing.
So, quick recap. I mean, if they already, as a parent, if they already have a dentist, you work with them, and you're looking at what, an 8 to 10 day wait time or whatever it is to get in the door, right? So it's
Yes,
not
sir.
months and months. I know the first time I shared with you, the first time my son, it was like a 3 month wait to get in or something like that.
Yeah,
So that's great. If they don't have a dentist, they can refer themselves to you, and you
absolutely.
can basically act as their primary dentist if you have to, right?
Exactly.
You'll do either one, and they don't have to have been a patient before, right? They can be brand new, walk in the door day everyone, and you'll see them.
Absolutely.
You take almost probably every different type of insurance. There's probably something that you don't out there, but for our kids and adult children, you probably check all the boxes there.
Yes, sir.
So there's really no downside. So tell me a little bit about locations, if you will, just
Yeah.
as the last thing, and then we'll wrap up because I don't like to waste a lot of time. Parents are tired. We don't have time to watch 45-minute videos
Yeah.
and stuff, right? So I try to be quiet or condensed and quiet down. Tell us
Absolutely.
about your location. How hard is it to get there? Sometimes we got to bring vans, and sometimes
Yep.
parking's and the stress of driving. Our kids are aggressive in the car sometimes, so
Yep.
sometimes tell us a little bit about the location, and then we'll wrap up.
Yeah. So we are in, for those that are Nashville relative, we're in Midtown area. For those that aren't Nashville relative, we are about 4 minutes from Vanderbilt Hospital. We're about 3 minutes from Centennial Park. And it's 528th North Ave, Suite 101. And I love the parking situation. Personally, I love it. It's a brand new facility, or I say brand new. They renovated, brand new facility. But there's actually, you can pull in, especially for the vans, like you mentioned. You can pull in, and there's a roundabout right by the front door, specifically for unloading those patients to get them right in the front door. As soon as you walk right in, I was like, that might not be. Oh yeah, if you turn it around. Almost like on the backside of that. So yep. Keep on going. One more. We're on the other side of the street.
It won't let me go any further. Stop.
Well, no worries. But yeah, we've got a parking garage.
Is
Let's
that
say it's
is
two
that
level.
the garage?
Yep, that's it.
There we
Yes.
go. There we go. Okay, there we go.
Yes, sir. Yeah. So
There we go.
that's the parking lot. So we've got a first level parking lot. You can pull right up to that left where those doors are, and it's got a roundabout, so you can unload safely, time efficient. No one's going to rush you. Unload. As soon as you walk in those front doors, we are right to the left. You don't have to go up an elevator. You don't have to go down or up any stairs. We're right to the left on the first floor. If for whatever reason this top lot doesn't have any parking, keep going towards the back, and we've got 2 to 3 level parking garage that they can pull around in the back, and then an elevator that'll take them right up to our front door. So they don't have to use stairs at all.
Awesome.
And parking situation is very nice for this surgery center.
Easy in, so kind of come in here, turn over here by where this white car is in the picture.
Yep.
Is kind of like where you would do like a drop off, and then
Exactly.
if you had to park somewhere, worst case scenario, you go back in here somewhere in the back. So,
Yep. Exactly.
But that's easy. Once we unload, parking's not necessarily a problem. So
Yep. That's exactly right. That's exactly right.
all right. Well, hey, I don't have anything else. If you were standing in front of 50 parents right now, what would the last words be that you said so we can wrap it up?
Yeah, no, I just been very grateful for the opportunity to share what it is that we do. Again, like I said, I took the job to help, not to make matters worse or try to make it harder. At the end of the day, my job is literally just to make it easier on you guys. It shouldn't be this hard to get the kiddos scheduled, to get them in, to get them seen, and especially with the dental work, we're already dealing with enough. They're already dealing with enough pain. My job here is just to basically make it easier. I've actually gotten a chance to speak with some of the Facebook parents already. We've actually already scheduled probably a handful of kiddos, and I've heard no complaints back. So I love that. But basically, like I said, at the end of the day, my job is to help you guys, but also just to be a resource. So I appreciate it again. And just thank you. If you guys have any questions, I'm absolutely here to answer anything that you guys have.
Fantastic. Well, Dakota Davis, Nashville Midtown Surgical, all your dental needs wrapped into one. Hey man, thanks for coming and chatting with me for a little bit so that we can share this and fill that need and void that's out there in our community for special needs families. So thanks, man.
Yes, sir. Yep. Thank you, Scott. I appreciate it.